Hi, this is Terry QT with Deep Sea Foundation. Welcome to the educational channel where we discuss all options for breast reconstruction and topics related to breast cancer and breast reconstruction. I'm joined today by my guest, Dr. Minas Chrysopoulo, who is from San Antonio, and he is with PRMA. Dr. Chrysopoulo is a board-certified microsurgeon who performs a variety of breast surgery and breast reconstruction for patients. And we would like to discuss with him today. We're using a new platform. So first of all, welcome, Dr. C.
Great to be here, Tim.
Yeah.
Thanks for having me.
Absolutely. His patients call him Dr. C, so that's how we'll address him today. And we're trying a new platform out.
Exciting times.
It is. It is. Last time I saw you was at the microsurgery meeting in January, which now seems like almost a lifetime ago. So things have changed, and we've gone through quite a big transformation in healthcare due to the coronavirus. Mm-hmm. So what I'd like to talk to you today, Dr. C, about is what I have observed, and I want to get some guidance and some words of encouragement from you, because what I've seen with patients just 2 short months ago, really, disappointment, emotional upheaval, because they had planned their breast reconstruction and all of that went away when the global pandemic started. So surgery was on hold. They knew they were going to be rescheduled. Now we've gone through this period of time, period of shutdown, stay at home, watching all of the news and information. Surgeries are starting to be rescheduled. Now I see patients who were disappointed that their surgeries were on hold. They now have become concerned, and for good reason. Mm-hmm. Exactly. So, while we still see incidences of positive testing, positive incidences of coronavirus being reported, now patients have a concern for safety as their surgeries are being rescheduled. So this is something new that we're all dealing with. But what I'd like for you to do today, Dr. C, is give us some words of guidance and help patients understand what it is that you're doing in Texas that could very likely, the vocabulary that they need to be discussing with their doctor could very likely transfer to whichever surgery center or plastic surgeon they are going to for their breast reconstruction.
Yeah, so great topic, a lot to cover. And everything we're going to talk about, I just want everyone to remember that it really does depend on where you are. So the region, what's going on in your specific area is really very, very key. So not everywhere is going to be the same. The fear associated with going back to surgery is very rational. You can't turn on the news without seeing the latest reports. Many of them are doom and gloom. And when you look at infection rates, it's a very complex measure to track, because now we have increased testing, and so people need to remember that infection numbers will keep going up the more you test. So we were very behind the 8 ball in terms of testing to begin with, and we still don't have universal testing, and we're far from it. So really the numbers that people need to be considering, I think more so or definitely in addition to overall numbers, is what are the admission rates to the hospitals? What are the admission rates to ICU? What's the ventilator use? What's the death rate? All those numbers together rather than just that one infection rate number, okay? Your doctors aren't going to do anything that put you at increased risk without weighing up the situation. They want to minimize your risk, and they're going to be options for different people, depending on their situation. It's also not just, it's not just folks who had breast reconstruction scheduled after completing all their treatment. You know, everyone's been impacted. So new diagnosis, whether it's cancer, whether it's a genetic mutation, having a planned treatment that had already been laid out, completely turned on its head because the surgery that was planned now is different. What was a mastectomy and deep flap is now a lumpectomy, perhaps. Some folks who are looking at surgery instead were started on hormonal therapy or neoadjuvant chemotherapy. So there's lots to consider. It's going to be a patient by patient basis. And as I said, a lot depends on where you are. Now, moving forward, as I said, the fear of COVID is rational, especially if you're looking at having surgery now and you're going to the hospital. You know, you've done a great job of distancing and following all the rules and minimizing your risk, and now it's okay, I'm going to the hospital and what's my risk, and I'm exposing myself. So universal testing for surgery patients, I think, is key. It's what we're doing here in San Antonio. So we're just starting now. Next week we're going to be reoperating again. It's select cases. It's not absolutely everyone. There is prioritization for patients who have cancer. And then slowly, after 10 days or so, once we see the lay of the land and how the process is working, then again, we'll have more talks with the hospital and see what's safe to proceed in terms of who to schedule. Everyone here in San Antonio will be getting tested before surgery. So all our patients will have mandatory testing. So if a patient doesn't get a test for whatever reason, the surgery will be canceled. If they test positive, and this is for the virus, not for antibodies. So the testing is done the day before. In some case, in one hospital system, it's the day before. In another hospital system, it's 48 hours before. And then after testing, the patient is asked to isolate again. But if you don't do the test, don't take, for whatever reason, you can't have your surgery. If you test positive, you can't have your surgery. That's to protect the patient first and foremost. And it's also to decrease the risk of exposure of others. There are other measures that have been in place now for a long time that will continue to be in place for the foreseeable future. No visitors allowed in the hospital. So the only people allowed in the hospital are those who can be tested. So we can't have a ton of family members coming and going who may have COVID and not know about it because they don't have any symptoms. So the traffic in the hospital has been minimized to only those who need to be there. It's a universal masking policy. It's the verbal screening and temperature screening continues as well. So there are multiple levels of screening. And then, of course, social distancing and everything else we've been doing. So we're gonna be starting that on Monday, actually, and we're going to see how that goes. And we're going to deal with any bumps in the road in terms of the process, tune things up, what have you, and then we'll gradually expand from there. What patients also need to realize is, again, depending on where they are, the degree of relaxation in the restrictions is going to be different. So some places are being very conservative. Other places are being very gung-ho, in my opinion. That's just my opinion. And then there are a bunch of places in between. So people need to remember that we all have to be prepared to tighten up the restrictions again if what we're doing leads to some increased numbers in terms of infections. So again, that's going to be very geographic. But at PRMA, we're very prepared to try this. We've been preparing for a while. We're taking things a week at a time, one day at a time. We'll be collecting data all the way along every day, and we're going to adjust. And if we see, for the first minute we see a red flag, then we're going to back off. We do feel very confident that what we have in place is as safe as you can make it. Based on the numbers we have here in San Antonio, we feel very confident that we are approaching this in the safest way possible. So hopefully, we've had a lot of great support from the hospital. We feel very good about the decision-making process, the committees involved, the people involved. No one's taking any decision lightly. The testing is available. It's mandatory. So that's the only way to go, in my opinion. And patients should, when surgery is mentioned again by their respective teams, that's one question to ask, obviously, is, what measures do you have in place? So they may or may not be similar to what we have in place here in San Antonio.
Right. That's part of the reason I wanted to do this video, is to hear from a surgeon who is going back, to surgery, and you say it's next week for you, to hear that vocabulary and to hear all these things. I like the fact, I really like the fact that what I'm hearing you say is that you're doing a slow rollout. You're collecting data as you go along to iron out any bumps along the way. There is one question I would like to ask you.
Yeah.
Because I'm going to the patient now. Really appreciate all this stuff that you have told us. But a patient goes into a hospital facility. They're surrounded by a number of different people. The patient, which I love hearing you say, has to have the test. What's the peace of mind for the patient with all the people that are in the hospital?
Yeah, well, everyone is wearing a mask. They're all gloved up. So that's not, I think, maybe something that's been missed in the universal masking policy. The number one reason that people wear a mask in their mind is to protect themselves. In reality, the big impact here is in wearing a mask to prevent infecting others. So the fact that everyone is universally masked and wearing gloves and all the rest of it is key. So all those measures have been in place now for a while. So it's a lot safer than going to the grocery store, for example. But people have to know that there's risk in everything right now, right? Because there isn't universal testing, so you just don't know, right? Which is why the precautions are there. So you can't give a guarantee, but that's exactly why patients need to know about all the measures that are being put in place at some places now, certainly the measures that we have in place already here. But these are the questions people need to be asking, because there's never going to be a guarantee, and people need to be comfortable that every measure that can be in place is in place to minimize their risk. Mm-hmm. So
I almost feel like patients now are having to make an even broader decision about this surgery. And that goes across the board, even for microsurgeons and all the healthcare workers. This is just a new paradigm shift for all of us. Can I ask a comfort question, a really simple comfort question that came to my mind as you brought up the fact that visitors, the guidelines for visitors in the hospital is going to change. Mm-hmm. I've heard this in the Facebook group that I admin that you're on. I'm so happy that you're on that group. So thank you for being part of that group. Really simple question. I've heard patients say, my partner, my spouse, my friend has to drop me off at the curb and I go in by myself. So I'm going back to my own surgery, and I have encouraged them. I said, FaceTime with your family, Messenger, do FaceTime Messenger with them, whatever you can do to keep in contact until you are released to go into the OR. But here's my question. Mm-hmm. I don't even know if you guys have experienced this yet, since you're going back next week. I'm sitting on the gurney, and I want to be talking to my husband. I've got my phone. I'm sitting here with my phone, got my glasses on, and I tell the nurse, I want to tell him goodbye one more time. Well, then you've got your phone and your glasses. Hand it off to the nurse and say, can you make sure I get this back after surgery? Seems like a silly question, but that's where my head goes when I think about other patients and what they're going to go through now.
Yeah, well, I mean, it's all in the timing, right? So you're not going to want to do that after you've gotten your cocktail to, your happy juice before you're wheeled back. So that's going to be the last thing you do before you, put your belongings away. And every hospital has its own protocol for keeping your belongings safe and secure. So absolutely, there's no reason why that can't happen. And where we've even thought about afterwards, right? Because all this emotional kind of the turmoil, the roller coaster, and now we're basically asking patients. Some of them will be lucky enough to go home the same day, and it's an outpatient procedure. Others will be staying overnight. Some of them a couple of nights. Our flap patients stay nights typically. So now we're asking those patients to do it alone without a family member, spouse, partner, whatever, with them overnight. So we're initiating a buddy system, basically a virtual buddy system. And perhaps we can work together, Terry, to encourage that for patients to buddy up, folks who've been through it, who may still be social distancing and isolating at home. Maybe some of your deep sea members can buddy up with patients about to have surgery to be available. And maybe, if we had more than one buddy for each patient going in, so that there's more than one person available, and patients take in their iPads and everything, and they can Skype or Zoom or what have you.
I love that idea. Let's do it.
Let's do it. Let's do it. We've talked about it at PRMA, and we're going to be that's on the cards. So, you mentioned the new platform. And I said that was exciting. Obviously, that's one of the few exciting things that have come out of all this. But let's really maximize the good stuff that can come out of this, right? And so I think the patient advocacy, online support, the studies are there. We know people need it, people benefit from it. Even if they have a strong support structure at home, in person, there's only so much that someone who hasn't been through it can offer. And there's always something that someone else who's already gone down the path that you're going on, there's always more they can offer in some way or another. So
I would love to be involved in that.
Yeah, let's do it. I mean, this sucks. It sucked for so long for so many people. It's going to continue to suck in some way or another for many people. It's going to be peaks and troughs. It will get better in some places, and then some places will spike and will revert a little bit. It's going to be probably realistically, it's going to be ongoing in one way or another. Could be seasonal before the vaccine comes. All sorts of reasons to prepare for this not to just go away like we all want it to.
Yeah, I feel strongly that we're in this for a bit of time.
Right, and that's why, the whole reason behind us talking today and addressing people's fears, it's important that people actually think about it, because it's very likely that waiting a couple of weeks isn't going to change much in terms of the fears, in terms of the processes and precautions that need to be in place, need to be followed. Preoperative testing for every surgical patient, I think, needs to be the standard in every facility. So it's something people need to get used to and ask about.
So to wrap things up, what do you feel? Okay, a patient had surgery scheduled in January. It got derailed because of the coronavirus. Now their surgeon, wherever they're at, across the country, across the world, is calling them now to say, we're going to roll this back out now and start performing surgeries. What would you say are the 2 or 3 top questions a patient should be asking either the nurse or whoever calls from the office to just bring a little bit of calmness and peace of mind? Real quickly, as a wrap up, what would you say?
I would say the 3 questions would be, number 1, what precautions do you have in place to protect patients and minimize my exposure to COVID?
Okay.
Number 2, what does the process look like for me going in for surgery? And then number 3, what other options do I have? If I want to delay things, what's the impact of delaying? What are my options? So I think, once you get those 3 answered, you'll have a really good idea of your own situation.
Excellent 3 questions, and it really covers everything that you talked about today. Dr. C, thanks for joining us today.
Yeah, you're welcome. It's been good. Important stuff.
Yes, yes.
Yeah.
And we will collectively get together here after we wrap up the Zoom, and we'll talk about the plan to help other patients out.
Oh, one more thing.
Yeah.
Um, Folks who are traveling, because we're getting those questions already, obviously, especially in our practice at PRMA. So our practice position on people traveling is as follows. We don't want to ask anyone to travel until we know we have it down. So, okay, so please understand to all our out of town, out of state patients, please know we understand the frustration. We understand that you need to get things done too and get on with it as well. But asking someone to travel when you're not, when you don't have all the data, I think isn't the smart way to go. So right now, we are starting cases, starting surgery again. We're collecting data. We're testing the process. We feel very good about it, but we do want to feel completely secure before we ask people to travel. That's a whole new step when you're now traveling for surgery, especially the protocol for taking into account the situation in the areas that folks are traveling from, right? And so it's right. And so all that has to be taken into account. Patient safety is paramount. We can't be blasé about things, and just because we're starting to operate again, open up the floodgates and tell everyone to come on down. So I just want to say we're working on it. We're thinking about all our out-of-town patients too, equally, and we'll have a plan moving forward. We've just got to make sure it's all patient safety first.
How about we do this? Sounds like we got another video in the future for an update.
Yeah, maybe, a follow-up, feedback, and maybe I'm sure there'll be a bunch more questions.
Yeah. So let's do that. We'll wrap up today. Dr. C, thanks again so much for joining us. Please comment and like the video when we have it on our channel, and let us know. You can subscribe to the channel, but also let us know if there's other topics that we can cover for you. Dr. C, thanks again for joining us today.
Thanks, Terry.
All right. Take care. Be safe.
Bye.
Bye.